This event will be recorded and will be shared after the video is processed by the council.
Okay, Representative Moran, do you want to test your microphone now? It looks like we've got your audio working.
She's on mute, I think.
Can you hear me now?
Yes.
Good. So are we trying not to be visible? That's the goal?
No, it's C and I are not on the panel. That's why we're not visible.
Oh yeah, they just have their.
The panelists?
Yes.
Yeah.
I have two meetings on at one time. And they both start at 12. I'm also
Just an FYI, Chair Liebling will not be using her video. So.
Okay. As long as we're able to still have the discussion, I think that will work just fine. In the interests of time, I think I will probably get started in a minute or so here, and we will hope that Chair Abler will join us soon. But I am mindful of everybody taking the time to join us today, and so we will get started just momentarily.
Can you hear me okay?
Yes.
Okay, great. Great. Sorry about the background thing. I just, you know, especially since you're recording this and all that, I just don't really want to, I'm not set up properly to do the background today.
That's all right. We are very glad to have you with us. Right. Well, I think we will go ahead and get started. I'd like to say good afternoon to everyone, and thank you for joining us for the Council on Asian Pacific Minnesotans for our final virtual 2020 session recap panel discussion. Today's topic will be on health and human services. In particular, I would like to thank Chair Moran and Chair Liebling for taking the time to join us today. I believe we're still waiting on Chair Abler to join us, but hopefully he will be in here soon. For those of you who may not be familiar with our office, the Council on Asian Pacific Minnesotans is a nonpartisan, independent agency established by the Minnesota legislature within the executive branch of the state government. The Council is tasked with the statutory duty to serve as the bridge between the state government and Asian and Pacific Minnesotans, both by directly connecting state government to API Minnesotans and by directly advocating on their behalf. My name is Andy Morris, and I serve as the Public Affairs and Legislative Liaison with the Council, and as part of my duties, will be serving as a moderator of today's discussion. We're also joined by other Council staff on the call, including our Research Director, Anjali Cameron, our Research Assistant, Daniel Yang, our Office Manager, Varak Chaithing, and our Executive Director, Sia Her. We've convened today's discussion as part of these statutory duties. Specifically, our objectives today are to be able to inform the community of key legislative achievements in the 2020 session, connect community members with key legislators, in this case, committee chairs, and emphasize the importance of continual engagement in the policy process at the state level. The 2020 legislative year has been unlike any other in recent memory. The arrival of the COVID-19 pandemic in our state and the protests and unrest following the murder of George Floyd have created a sense of urgency and need for leadership that has far exceeded that of a typical year. the usual processes of state government and the legislature have also been upended, requiring perseverance, creative thinking, and intentional use of limited time and resources to ensure that the voices of Minnesotans are heard and reflected in the work of the government. While many issues have emerged, one of the most pressing and continuing concerns have been those related to health and human services, not least of all with the COVID-19 pandemic. To discuss the issues related to these topics, we're joined today, and I see that it appears Senator Abler has joined us now, by Senator Jim Abler, Chair of the Senate Human Services Reform, Finance, and Policy Committee, Representative Rena Moran, Chair of the House Health and Human Services Policy Committee, and Representative Tina Liebling, Chair of the House Health and Human Services Finance Division. Chair Abler represents District 35, which includes the cities of Anoka, Coon Rapids, Andover, and Ramsey. Chair Abler was first elected to the Minnesota legislature as a member of the House of Representatives in 1998 and served in that chamber for 8 terms before briefly leaving the legislature. He was then elected to the state Senate in 2016 and is currently serving his 2nd term in that chamber. Chair Moran represents District 65A in St. Paul. Chair Moran was first elected to the Minnesota House of Representatives in 2010 and is currently serving her 5th term. Chair Liebling represents District 26B in Rochester. Chair Liebling was first elected to the Minnesota House of Representatives in 2004 and is currently serving her 8th term. Before we get started, I'd like to provide an overview of our program today. We'll begin the panel with a moderated discussion with the chairs about their work this year and looking ahead to the fall and to the 2021 session. We will then open up the panel to questions from the community. If you have a question that you would like to ask, please submit it in the chat window in WebEx, and we will try to get through as many community submitted questions as possible today. The event will be capped with closing remarks by the Council's Executive Director, Sia Her. After Sia has provided us with some closing words, we'll then give the panelists an opportunity to leave us with their final thoughts before we adjourn. And with that, I would like to invite the chairs to offer a few words about themselves. Not to pick on anyone in particular, but Chair Moran, would you like to kick us off? I believe you're on mute. Okay.
So hopefully you can hear me.
Yes.
Great. So hi, again, my name is Rena Moran, and I have been representing St. Paul, Frogtown, Midway, the historical Rondo community, a little portion of North End on Rice Street and Cathedral Hill, a very diverse district that we believe, and I believe strongly, that our diversity is our strength, and it allows me and individuals from our community to bring a diverse perspective into the legislative body to create policies that are fair and just, that represent our voices in the legislative process. And so I want to thank you so much for the invitation to be here, to be part of the council end of the year legislative session, to recap some of the work that we have done that really, as you talked about, COVID-19 showed up in the regular process, in the regular legislative process went into a COVID-19 focus. And so we'll talk a little bit about that in relationship to COVID-19, and also some of the other bills that were able to be heard and that passed through the legislative body. It's good to be here.
Thank you. Chair Liebling, would you like to go next?
Sure. Well, first of all, thank you so much to the council for hosting us today. And I view it as a great opportunity to have some discussion on, I'm looking forward to taking questions and hearing more from the council. So I do represent District 26A. I think he's B. I'm not sure why, but it is kind of the central part of Rochester. So Health and Human Services is kind of a natural for anyone who represents the district where the Mayo Clinic sits. And a lot of my constituents are people who are deeply involved in healthcare in one way or another. So I will kind of leave it at that. I did appreciate your introduction, and you know, we are at a defining moment. So on so many levels that these things are coming together in it, and you know, it's like the old what they people say is a curse of may you live in interesting times. We do, and I think that we have a great opportunity to make transformational change. And thank you all for doing this today.
Thank you for joining us. Chair Abel, it looks as though you've found a place to settle.
Yeah.
Right
I should have turned the video off while I was trying to find a place. I thought I found a place, and actually kind of caught me on the road here. So I had a hearing this morning, and anyway.
Thank you very much for joining us.
Well, and I'm happy to, thanks for inviting me. I really appreciate it. It's, you know, it's really a privilege, and I'm sure the other panelists would agree that it's, you know, it's not very glamorous to be in office. People think, oh boy, that's really great. But it's really cool to be able to help in so many different ways. The COVID thing, this is going to pass. At some point, it's going to become just another thing that people have. It might take a couple of years to kind of work its way through. But tomorrow is coming. The challenges that we had yesterday in your community, and you know, are still going to be there, and maybe magnified just because some of the stresses we're under. But it's really important, and I'm committed that everybody has a chance to succeed and to be treated fairly throughout, you know, their lives. And so we've got our hands full. You know, this whole Zoom business, how many Zoom meetings has everybody had? You can't really see the people. Like in another setting, there would be some audience of some sort of the group, and we could get to look at you and like kind of react to how you're reacting to me, and change my methods, my message or my method a little bit to try to help people understand whatever it is we're talking about. And it's just really a curious time. But I'll just echo what the other two representatives said. We do work quite well together. We don't always agree, but we're always agreeable and with to keep talking. And we've had some great successes even this last session. There was a bill we passed, House File 11, with Senator Moran, and another one with Representative Moran and Representative Liebling, about some human services and redefining what it means to be served as a person with a disability, and that the move is toward independence and a better life and all the opportunities. And then we worked together with the department and Representative Liebling to continue some of the emergency powers past the end of the peacetime emergency, which is actually going to come sometime. And how do we keep those flexibilities going? And so for all what you read about, there's a lot of cooperation behind the scenes. So glad to be here, and thanks for having me.
Well, we're very glad to have all three of you join us today. To kick off the discussion, it's I think important for us to note, as we've heard throughout our panel discussions this week, that even though the regular session has ended, the special session has ended, that it's very important to emphasize that legislative work continues to go on, even when there isn't a session happening. Of course, this year was quite different than normal. Thinking back to ahead of the session, the regular session in January and in February feels as well as it may as well have been a totally different lifetime ago. With that said, I'd be interested to hear, and certainly while there have been some major issues that have come up that have demanded new responses and new thinking, I'll be interested to hear how that has impacted the priorities for your committees, both from the perspective of what has remained consistent and what required change. Senator Abler, since you the last time, would you like to
Sure.
take that first?
Yeah, that's fine. Yeah, so I think if there's a change, and certainly everything has changed. People are some of the things that were mediumly important or nice to do but not critical have just fallen onto the cutting room floor, as it were. We have found ourselves dealing with essential matters, at least matters deemed essential, life and safety, infection control, how to handle a nursing home with the COVID, all these things, life and death. A lot of things we do can affect your life, but they don't really cause life and death. If it wasn't life and death, it went away from any improvements in the systems. I'm actually kind of pleased we got that big House File 11 done, because there was a lot of good policy. Most of that was sorted out before we got into the pandemic time, where we started closing down. And a lot of really good policy. And so it's just been more emergency kind of work. And actually, it's been more centralized. We've had less hearings, and more things have been determined by some power higher than us as they work through stuff. And we tried to interject things we cared about. But it's in the emergencies, things centralized. The governor has taken on quite a bit of independent authority. And when there's been some legislation, it's often been with just a handful of people in the room, a few leaders. I think in the first bill we passed, or the second one, there was not even staff. It was I think just a handful of legislators, the very leaders, and not even support staff. So it's just a way different, and I miss the collaboration that we had and our attention to the detail, because at the end, it's the details that actually make the difference on how our programs work.
Thank you. Chair Liebling, would you like to go next?
Sure. And as you can see, I got a background going here. So I also moved while we were talking. Yeah, there's nothing that Senator Abler just said that I disagree with, certainly. I guess would amplify a little bit. I think that because of the peacetime emergency and not just the declaration itself, but the pandemic and the need to suddenly shift focus, it really has upended the way the legislature usually works. And it's also really changed the relationship of the legislature and the governor. Clearly, the governor, under the emergency powers, is making a lot of decisions, and across every area, many areas, I should say. And so it's really shifted our role, I think, to one of advice to the governor, to the executive branch, and also oversight. And I think you'll continue to see more of that. So in terms of priorities, I mean, we've had some hearings that have mostly been around trying to understand what the administration's doing, give members a chance to ask questions, express concerns. And that changing of the balance between the legislature and the executive branch is something that we've certainly never seen. In my 16 years now in the legislature, I've certainly never seen anything coming close to that, especially when it comes to, there's the federal CARES Act money that came to the state that really the governor has the authority to spend. And so we have an executive branch that can now allocate funding without the legislature appropriating that money. So there's somewhat of a struggle to say, wait a minute, we have a prerogative here too, and we want to make some decisions. And so there's a lot of pushing and pulling, and I think I would venture to say that some of us are more uncomfortable than others, but probably all of us are at least a little bit uncomfortable. So in terms of priorities, clearly we want to help Minnesotans get through this. And we are completely, painfully aware that our most vulnerable Minnesotans are suffering the most, and that the pandemic, COVID-19, is not hitting communities equally. And it's really highlighting and exacerbating a lot of disparities that we knew were present. And so I do think it's creating a moment of new attention and new resolve to make some fundamental change. So I'll stop there.
Thank you. Chair Moran.
So I remember coming into session as a new chair of Health and Human Service and asking members to, reimagine what healthcare can look like. Just let's try to reimagine what it is we need to do to work to ensure that we were doing no harm, but also making sure that folks across the state of Minnesota were getting their needs, their healthcare needs met. And because healthcare is so vast, it can deal with healthcare to insulin to tobacco, right? It's just, what that looks like is so vast. But also to look at this work through the lens of prevention, and how we can not spending so much money on the back end, but, focus a little bit more on preventing things from happening. And of course, COVID-19 showed up, right? And this is like, we're going to do a lot of reimagining here that has to be done about how we're going to get through this pandemic. How are we going to minimize the impact and the deaths that may be lost because of COVID-19? And also at the same time, learning about something that's new that has just kind of like brought our state and our country to a new level of awareness, of engagement, responsibility. And so by having a process already in place, and that process has been thrown out, and one, because we knew we had to respond early. So yes, I agree with my colleagues, Senator Abler and Representative Lieveling, about the impact of the executive orders. And we can debate, whether or not the governor has, whether we want to legislate. But what I do know, what would happen if that we had not given the governor some executive power, we would still probably be debating many of these issues about what's right, what's wrong, and what we need to do and how we need to allocate money. So having allow him to have that privilege to take politics out the way and to do what was in the best interest that we thought that we think in the behalf of citizens was delightful to see things that's moving so quickly and having a consistent message around we all responsible, not just to ourselves, but our children and our neighbors, right? Because this pandemic doesn't just impact you. It has big consequences for any and everyone you may come in contact with. And so we're there, it has definitely been a challenge. At some point as legislators, we do want to be a part of legislating, and that really is important that we are able to do that. And once we was able to move into this new process, we had to reimagine what it looks like to legislate, through Zoom. Here we are using Zoom, and how to get all of those mechanisms in place so that we can do it in a way that also engages the public. Took a while, but we was able to move from COVID-19 to moving legislation.
I think that's a great transition to thinking about some of the issues that we will continue to face, and the state government and legislature will continue to work with. Unfortunately, it seems as though, at least for 2020, we will continue to be grappling with COVID-19, and that will continue to be, I'm sure, very central to the work of all of your committees. That said, as I mentioned in my opening remarks, and as you have all touched on, in no small part due to the pandemic, the way that you all have gone about doing your work, whether that's is through the remote committee hearing process, or even how, and I suppose actually as part and parcel of that, how the community and how the public has a chance to be able to engage with the policymaking process. I'd like to get a sense of how you view, and certainly things have shifted over time since March, but how you view things that worked well. What do you think could be done better in terms of how the legislature does its work and engages with the community? And then what sort of path do you see us on heading into the rest of the summer and into the fall? Chair Liebling, just kind of picking
Okay.
evenly
Well,
here to start.
okay. Did you mean like how we've done in terms of since the pandemic started with having community engagement, or is that, I wasn't exactly sure.
Sure. The question is, I suppose, um, given how the work of the committees in the legislature has shifted as a result of the pandemic, what do you think has worked for you as legislators and as committee chairs, and what do you think could be done better?
Well, there is a very real sense in which we are not set up to do it this way. And we are not set up to do it even now because so people used to, for example, call our offices. And of course, the amount of phone calling has diminished over time and shifted to email as in terms of just constituent contact or citizen contact. But now there's nobody in the office to answer the phone. I mean, our staff are struggling to be able to pick up messages and so on, but it's really created a situation where email is kind of it. And that's not terrible, but our emails are flooded every day with all kinds of things. And I have been thinking about this a little bit, how it really, there's no real prioritization in there. It makes it very easy to miss things. It makes it very hard for an individual person to get their voice heard. When you're getting 500 emails, it's likely you're going to miss the one person who says, hey, I need help with something. Or I know you're working on X and I want to put my individual voice in. Because we get mass emails all the time and all kinds of other stuff. So, I mean, that's kind of a practical. So in terms of like saying to people, how can you reach out to your legislators now? I think that's a real concern. How can you still do it? It is incredibly important to us that people be able to reach us because we all know that we don't know everything and we need to hear from people often on the things that they have some personal interest or some expertise or some experience. So we're still kind of stuck with that email system that seems not really, to me, completely up to the task. And if we continue to be in this social distancing environment, we've just got to find a better way for citizens to continue to be involved because that's what legislatures are supposed to do. We are set up to take input. And we are, in addition, legislating is a team sport. So we need our colleagues to, everybody hears from different people. And hopefully when those voices get brought together, you get a better product because you have those different voices coming in. And so we do still have that, even though it's virtual, but we've got to reimagine the citizen contact piece because my own feeling about it is that it is not up to the task.
Thank you. Moran, would you like to go next?
So the question is, what has worked and what can be done better? So I remember everyone having to go home. and said we no longer can jeopardize not only our lives, but the lives of the community, the folks who was coming into the Capitol building, the state office building. And came to the point is trying to figure out, how do we make this work? How do we legislate? How do we create a process that engage um, uh, folks from the community in a way that they feel engaged and part of the process, and that we can hear and listen and have testifiers? And that was a challenge, and it took a while to create a process that is a needed process, that we were not doing things without the input or without the observation of community folks being aware. It's a new thing, but we made it work. It wasn't the best way, of doing our legislative work, because, we're social beings, and it's really important that we are able to feel the audience and see I'm calling them audience, and see the audience, and know that they're present. Those things help direct often, and sometimes, our own stories, or how we look at issues, or look at solutions of problems. But I think we create a process out of impossibility, and made it possible. So we was able to do that. So I'm hearing feedback. So let me know if you're hearing the feedback that I'm hearing. If you're not, then that's great. But I definitely hear it. So I was able to, what worked was impossible process that became possible, of having hearings and going through a irregular type of legislative session that was challenging for all of us. And I think it's still challenging. Me doing this Zoom is not right. It's not normal for me. What could be done better? So in talking about, creating a process for community to be engaged, it has always been a challenge for communities of color to be engaged in this process, to be present in the Capitol, to have their voices heard. And I think we still have work to do to make that a possibility for many in my communities through this new process of being able to access and go to the website and be able to log on, sign on, and to follow us. And I think the more intentional we can be with, building those relationships with entities out in the community that can be that network of support for a process that is an uncommon process for many of us and for my diverse communities, will be helpful. And I would think it would make things better for the legislative process that we're currently going through.
Thank you. Jerry, boy.
Yeah, thanks. Actually, in some ways, it's made things a little easier. Having this meeting, I had a hearing virtually, had 10 minutes to sit down somewhere else and do a little thing on the way. And so here I made it, didn't have to drive. I couldn't have driven to St. Paul or wherever we were going to have this if I would have had the meeting. And so in a way, it's actually a little more open for people to watch because the meetings are far more electronic. In the very often, every hearing is not on TV, and these are all able to be watched. And so you don't need a lot of money to have a phone and watch something that you're interested in. And so you don't have to have, it may actually be eliminating some of the barriers there, as I just think of an optimistic thing. Not getting to see people in person is really rough, though. The body language, as you know, is 90% nonverbal. And I'm doing this on my phone, and I can barely see I can't really make out the expressions if I'm trying to communicate with my two colleagues. If I'm trying to have what do you really think? And, the little ways you blink your eyes and, have a little grimace or a smile or something. And so you lose a lot of that. And a lot of the work is collaborative. And I cannot tell you how many times you wander down the hall and go talk to one of your colleagues, or you run into a lobbyist in the hallway, or just a citizen asking something, and then you have a chat, and and you have a nice little interaction. Those are all have to be much more conscious now. You have to set up a time to have a chat, and then it's not spontaneous. And so many times I've just dropped what I was doing and quickly gone down 2 floors to see if so and so's around, and oh yeah, hey, here we are. And you can't. Everything is now just more purposeful, and so hopefully this time will come to an end. I remember talking to Rena. She did, I think she did House File 11, a 490-page piece of legislation on Zoom, if I remembered what her plan was. And that would never have happened. And so if you're sick, you could go you can participate by Zoom as a legislator, or just have something else you had to do and have more meetings. And I hope we don't evolve to this being the normal, because I think they'll be a little more visual, be more visible to people, but I think the interactions and the learning is going to be less. So time will tell. But at least this may be one more avenue that we'll have, which could be kind of interesting. And so maybe we'll keep up a Zoom option where we'll have a live hearing and then people could Zoom in or something. That would be actually kind of handy for some people who are not able to get to the Capitol because of transportation or because of they're geographically remote. So stay tuned.
Thank you. Before we transition into the community questions section of the program, I want to note that even though we are, billing this event as a session recap, that more than likely we will be looking at another special session at some point in the future. I don't think we know necessarily when that will be yet or what issues we'll be taking up, but at least from the perspective of the chairs as legislators and as from the perspective of your committees. And Chair Abler, you mentioned that you were just holding a hearing just before this, joining us here today. But in the context of if the legislature does come together again for a special session, what type of work do you see in the context of your areas of responsibility being addressed? Chair Abler,
Sure.
would you like to go first?
Yeah, well, you don't even always know what's going to happen in this kind of a crisis time. And so you make your best. The legislature, actually, given how clunky it seems sometimes, that's all of us doing our best to make it work. We may not agree on things, but universally, the people who are in office care about something in the way that they care about it. And if enough people care about it that way, then you can change a law or something. Otherwise, you have to persuade, and you might get a part of your idea to go. And so there was a lot of well-intended actions that were done early in the COVID, and some of them have had significant ill effects. The hearing we had today was about the whole disability services network, the day services and the transportation, the services for children with autism and people with other needs, and a number of those places, just because people couldn't go, are likely to close and not have access. And it's hard enough to work in the Medicaid system as it is. And then when you add in maybe only getting 5% of your revenue or 30% of your revenue, and when your fixed costs are half of what you used to get, it's really a bad business model. And so we're working on trying to find a way to get some of the emergency COVID funding into the hands of the providers who we desperately need to be open. It's not our job to protect providers, as I said over and over in 2011 during the last big deficit, but it's our duty to provide services to the people who need them. Not just our moral duty, it's also a legal duty, and we could get sued. But Minnesota has taken a very, I think, caring and an open view of trying to help people with disabilities of all, natures, to be well served. And the people with disabilities are not a homogenous group of any particular culture or race or income level. It spans everything, and it's the Asian community and immigrants and, African Americans and Caucasians and of every different geographic thing and economic status, and it doesn't know any boundaries. And so we have taken on ourselves to try to craft a system that works pretty well. And in the human services world, there's about 1.1 million people who get something in terms of some support, healthcare or SNAP food assistance or disability services or something. And so the three of us have developed quite a collaborative approach over the years to try to find our best way to do it. And now we're in the middle of this emergency where a bunch of these places are about to close in the next month or so. And so we've been talking a lot about that. That was today's hearing. We're trying to find a way to address getting PCAs some extra money. That's been harder than I thought it would be. Because they go into places and they don't make that much money to start with. And so we thought we'd give them a little bit of, combat pay or something. And that is surprisingly gotten sidelined. Maybe that'll come up again. A lot of the big topic areas with the issues about the police and the bonding and taxes aren't going to touch our niche very much. But we're all very interested, and there's certainly all those areas will touch our arena, at least indirectly, as we try to find ways to make sure people are all treated fairly, and we, especially next year, as we try to hit our budget. So I'll just leave it at that.
Thank you. Chair Wee-Wing, would you like to go next?
Yeah, would you mind repeating the question? Because I've kind of lost it a little bit here.
So the question is, looking towards the future and anticipating that we may be facing another special session at some point, either in the summer or beyond, what work do you see in the context of our conversation today on health and human services that may need to be addressed or continue to be done?
So I think it's almost a given that we will have another special session, and probably more than one, because they're just, we are a part-time legislature and there's just too much here. I mean, under normal circumstances, the legislature would not be in session now. It would have ended in May, and then we would come back in January. So during this normal times, the administration would be taking whatever instructions we had given in law and then carrying on until we come back into session. But we're in these interesting times where, as I said initially, oversight is necessary, and to make sure that we bring the voices of Minnesotans, which members of the legislature, every one of us representing a district, we at least we like to believe that we're closer to those folks. So the ones without the lobbyists, the ones who might contact us by email, as I said before, or or in person, or we try to represent those voices. So it is hard to say. Well, one thing we know for sure is that we are going to be needing to cut back on our budget. There's just no question when you look at the forecast. And I have been through that before. Senator Abler, and probably Representative Moran as well. We've all been through that. And it's bad, it's hard. So even though we're not doing that right now, I think we're kind of, it's got to be in our minds that we're trying to figure out how can we both move forward with the transformative kind of change and seizing the moment to say this equity has to be the highest or very, very high on our agenda right now, making sure that all Minnesotans have the opportunity to be healthy, to get the services they need to move forward, to try to really address disparities, and yet knowing we're going to have a lot fewer dollars to invest in that. So that's going to be a real challenge, but it's something that's on my mind a lot. And just before this meeting, I was on a meeting with the Blue Ribbon Commission that was set up to work on some of these issues well before we knew about the pandemic, well before George Floyd was murdered. That commission is struggling also to kind of pivot to meet the moment and to bring forward not only ideas for reducing expenditures, but to say, how do we go forward and really help move our state, not only through this difficult moment, but into a better position going forward. So, that's not very specific, I guess. I could probably talk more about specific things. Let me just address the PCA issue since Senator Abler brought that up. The challenge has been that to raise wages for personal care attendants, and we've tried now, the House passed something several times. It does take general fund money because it's federal expenditure. It's a matched Medicaid expenditure, which means that the state has to put money in. And there's been a red line drawn that says no general fund expenditure. And while you've got that going on, you can't raise their wages. And it's just, there are items, we still have kind of leftover items from the session, budgetary items, things that are really, really important, but they do involve spending some money. And while that is just kind of a non-starter between the Senate, I should say, and in the House, frankly, the House Republicans have been very clear. We're not in favor of anything that spends general fund money because we have a future deficit. It's going to be really challenging how you wrestle with some of those things that just have to be done, like raising wages for PCAs.
Thank you. Chair Moran.
So Representative Lieberly and Senator Abler both talked about the PCA workers who, in the midst of COVID-19, are still out there, taking care of the disabled, the most vulnerable, those in crisis. And yet they get little or no money at all. And they're putting their lives and the lives of their families in jeopardy. And I kind of like that phrase that Senator Abler used. He called it combat pay, combat, that they are really out in combat. I was like, wow, that is, that visual that I just saw from that language was, is that alone, that visual would like preempt us to say, we have to do something for this group of people at this point in time. So if I don't know if you know, but Senator Abler talked about House File 11, which was a bill that I was carrying in the House, and Abler in the tiny bill in the Senate, that was not able to make it through the regular session. And so we were able to pass that during a special session that really entailed a lot of good things, from early childhood provisions around child care assistance program, looking at modifications of guardians and conservatory background check timelines, which is important. Looking at the FAME program, which is there's dollars sitting out there so people can save and buy a home or a car or pay for the education. And so we was able to take care of that. Looking at the child protection system, and allowing foster care parents and birth parents within the first 72 hours of a child being removed from home to make that critical phone call between the parent, if possible, and a foster parent on behalf of the child. So, a foster parent can ask whether or not, does this child have any allergies? Does it have a special bear that they likes? And the parent can say, okay, I feel a little bit more confident knowing where they are. Critical things like that, looking at the ARRM, the Armed Policy Bill, a fixed exchange for the CCBACs, just a bill that was full of just so much good for Minnesotans across the state of Minnesota, happened in a special session. And as Representative Lieberly talked about, like usually at the end of session, we're done. And I think for Health and Human Service, we're done. I don't think that unless another crisis show itself that we need to respond to, and legislation needs to come out of some other crisis that we may see between now and 2021. I do not believe that you will see, not that I know of right now, any other bills being moved through the legislature through Health and Human Service this time. It is an election year, so we need to get out there and engage folks around the power of their vote, you know, and their voice.
All right, thank you. We'll now begin addressing some of the questions that we've received from the community. The first one we have is framed with a comment, so I'll just read this. That many cultural healing practices have not been recognized through DHS, which is the Department of Human Services, reimbursement process for mental health and behavioral health fields. Last year, Governor Tim Walz proposed $2.4 million annually in grants to the state's 11 tribal nations and 5 urban American Indian communities, offering more access to traditional healing programs for American Indian communities statewide. Has there been any discussion around if beliefs like Hmong shamanism could be included as part of the holistic healing as well, and be eligible for similar grants to be included in the DHS system for potential mental health support reimbursement?
So I guess I gotta open up and start.
Go ahead.
One of the things that I know we have been working in the House to really bring equity lens to all the work that we do, especially within healthcare. Health equity, which is to ensure equitable access to, whether it's with the COVID-19 to equitable access to testing, you know, that was really important. Also, utilizing cultural healing processes for diverse communities. But just looking at, you know, again, reimagining what healthcare needs to look like to create better outcomes for people. And part of that is, you know, it should be around cultural healing priorities. So our People of Color Indigenous Caucus has been working like really hard in this process. I had something that I wanted to hear that talks about the healthcare disparities that we see within our healthcare system, and really looking at how we could bring to the forefront what we believe as people of color with the lived experience, the life experience ourselves, but also help that direct connection with our communities about what is important or what creates better outcomes for our community. And what I would say is that we have not done that in a real way. We have not expanded how we see solutions in a way that we want to invest real dollars or look at the policies that create the practices that we would like to see more often back in the communities. I have not heard of anything Hmong healing. So what we do need from the community is your help, is your input and your insights about what that looks like. A lot of times, you know, there's either red tape or there's practices in place that weeds out those type of initiatives because they traditionally have not been done, you know. So anything that's evidence-based, culturally based, I think we definitely need to do more and should do more in that arena. But it's not always easy for people to see that work through what we would call a health equity lens.
So I would like to say a couple things about that. It is a question that really brings up a tension that exists. And I think Representative Moran just really referred to it. We're talking about what's evidence-based in the state. There has been in recent years a real push to try to understand which strategies have evidence behind them, how much evidence they have, and you know that have shown to be outcomes. And then that's in tension with some strategies and practices that don't maybe have quote unquote evidence because not everything is equally susceptible of that, right? So when you take this sort of certain lens and you want to look at everything with this certain lens, you may be missing things that are valid and deserve support, or at least deserve examination, but don't fit into the box that's been created to weigh them and measure them. So it is a dilemma, and unfortunately, when the legislature is in budget cutting mode, it becomes that much more difficult to try things. I think Senator Abler mentioned this before, that so this is the dilemma, right? We want to find better ways, we want to find equitable ways, but we also want to make sure that the things that we invest in will have a better outcome for people. So how you balance all those things is extremely difficult. And I think Representative Moran's kind of call to people to help us do that is excellent, because, you know, I can't be supportive of something I don't know. And, you know, what you just mentioned, the shamanism, I think you said, and I'm not familiar with that. So, you know, I come with my narrow culture. And I'm glad that we now in our legislature have much more diversity of culture. And we have members of our Posse Caucus who are, you know, extremely helpful. But even there, we don't represent every group. And, you know, we still need a lot of citizen input to just educate us, begin to educate us about some of these things, and work with us to figure out how we can, you know, what we can do to try to move them forward. You know, not saying that we would be ready to spend millions of dollars to get something to happen right now that is brand new, but you never know. I mean, it's you got to start the conversation.
And let me offer a comment as well, just on the more global idea of this. I've had the privilege to serve 21 years in elected office, which I don't know how that ever happened, but I remember sitting down with the Department of Health, and they have a whole bunch of grants that are, you know, meant to reach out to health disparities and different topics that are interesting to various communities. And it seems like they get stuck in their little system about how they're going to award a grant. And this is actually practical for probably a lot of the attendees today. How do you get your really interesting idea to be funded? And the answer is there's a lot of money out there to fund a lot of this stuff, but they're very rigid in how they go about approving it. And so they have this evidence-based thing and double-blind studies and so on. And a lot of these, and I pushed back on that. I mean, you want to have things that have evidence, of course, but some things are very promising, or some things actually really have a great reputation for serving a particular population. But that group doesn't have access to a really good grant writer. And sometimes a bad idea or a really mediocre idea gets funded because they have a really smart grant writer. And some of the best ideas that would really turn the system in a way go lacking and never come into their own because of who they don't have the expertise or the right person to say things the right way, or because somebody on a panel has a particular bias against something. And I pushed and I just about got nowhere. I thought I was pushing a boulder up a hill. And then if you get a little ways up, sometimes the boulder runs you over. But it's still worthwhile. And so part of it is how you design these grants. And the Department of Health has a bunch of these, and DHS has a few less on the healthcare side. But there are really things that could do a lot for mental health and supporting people in, you know, various ways that are lacking in the face of a good deal of money going out. And I think as we look forward into the next time coming where a dollar has become much more valuable or just more sought after, we want to make sure what we're doing actually does do some good. And even some of these evidence-based double-blind studies are really pretty mediocre in what they actually accomplish. So I think that the community we're addressing today of all would want to make sure that we reach out and touch everybody. And so I think that helps achieve the goals of the equity that we're looking for, and health improvements, and having a chance to live as good a life as they can. Thanks.
Thank you. Our next question touches on our discussion yesterday, which we held on E12 education and some of the challenges that have resulted from distance learning in particular. And the question is, where are we with mental health support for students? Has there been an increase in funding linked to mental health or full service community schools? I know that based on what we've heard yesterday and in other conversations, that distance learning has been incredibly challenging for many people. So it would be great to hear your comments on this.
So if I'll jump in on this one. So I can't really speak to the education piece of this because, that's outside my expertise area. But in terms of the school-linked mental health grants that have been now going on for a few years, and where students have been able to get mental health services in their schools, was a very successful and well-supported program. And we did put more money into that in our last budget. And one of the flexibilities that has been given under the emergency is for those services to be delivered by telemedicine, if you will. So, it's never going to be a real replacement because for many students, probably, seeing some supportive adults who are not their family every day, and having actual contact with someone in a therapeutic role for them, that I don't know how well you can replace that with virtual, and maybe they may not even have virtual access. But there is an attempt to try to make those services available. So yeah, I think we're all aware that the distance learning is exacerbating some disparities. It is not ideal. As human beings, people need each other. We need to be together. And it's really distressing. It's more distressing for some than others. And people who don't have the best situation at home are now, we see this a lot with meals, for example. There's been a lot of information about students who no longer get meals at school. And, there's been a big effort to try to push meals out into the community so that our students aren't going hungry. But, I wish there was a better answer, but it has been on the mind of legislators for sure.
And it's on my mind, and we did some good work last time adding the school-length mental health grants, and it was good to see that cooperation at the end. I think there's nothing like a one-on-one interaction or a group interaction with some of these the cares that people might be getting or needing. And you can only do so much through a little iPhone and talk to your person and get their advice or to work through your problems. The mental health issues are really remarkably profound. The reports are that this COVID separation has, even they've listed some causes of death in nursing homes as being the separation piece. But on younger people with less where their connections are all at school, they've really lacked a lot of that. You can only you enjoy your mother and father, but there's only so much that you can, so many hours you want to spend with them. And so I'm not actually even persuaded that the decisions about closing schools, as much as they have been, was the right one. I was disappointed that the students couldn't go back for the last 2 weeks and say goodbye to their senior friends and so on. And since especially the incidents and the danger to the average teenager or young person is so extremely low on the COVID thing, and you don't want to give it to your grandma, of course. And so in all of this, I say that knowing that the statement I made is controversial. Good people don't have to agree, but good people need to keep talking and raising all the points. And in the middle of a great disagreement, and there are people who would absolutely disagree with my statement, you want to keep the dialogue in a civilized, fact-based, or at least just a civilized manner so that all the voices can be heard. And I think for the communities that are paying attention to today's chat, every voice needs to be heard. And I don't know the differences that one community has over another with the separation. Has it affected, the Asians more or less, or the African Americans, or the Hispanics, or is it all the same? And those are really the more that we all keep talking, the more we can learn how to best do it. And just while I'm thinking of this sentence, the legislative process is by its nature a very imprecise, often incorrect way to go about it. Hopefully we'll learn from what we didn't know and do it better next time. But it's more correct and much better when more people are engaging, as Representative, both Representative Moran and Liebling mentioned. We learn a lot from the people just crossing our paths to realize what thing we didn't know about, we might actually have an unintended consequence. Thanks.
So I would also say that this distant learning has been a really big challenge, for probably 50% of those who are engaged in the school setting at some point. It's been difficult for many students and also for parents. And we look at distant learning and everything's about doing your learning over your computer or on your phone. And so we know that access to internet has been a challenge for folks. Having a hotspot has been a challenge for our young people in their education and trying to respond. We also know that that parents who are being challenged around utilizing the internet, you have more than one child in school. You're dealing with 3 different kids. Sometimes some of them don't all have their own computer or access to a phone, because so many parents are not working now. Phones are being turned off. They are not able to even keep a cell phone. That is kind of like how critical it's gotten for some families. Looking at students who have an IEP and a 504 plan, their needs been taken care of. That is, it's very hard for independent learning to take place for many of that population who have an IEP or who are English language learners. It gets to be very difficult for a process, and often the parents are struggling as much as the children, and often the teachers are learning a new process, and so they're struggling too to try to dive into this new experience of being tech savvy. And so we will for sure see worse educational disparities. And so part of what our Posse Caucus and our People of Color Caucus did was have really this huge conversation with the Commissioner of Education, because we were still in this mindset around, full service schools. We're still in this mindset as if we was in a normal moment. And we don't know how long kids will be out of school. We don't know if they'll be ready for school come September. We do know the last half of the school year, they was trying to cope with distant learning, which is a huge challenge. And so we know this has a mental impact on children. They're stressed. Young people are they're so stressed that they're talking about suicide. The disconnect that they're having from their friends, that social part that is needed. It has been like extremely, extremely hard for so many young people, and even those who are in junior high and high school. And so looking at the mental health of students, of young people, to mental health of parents, but also the mental health of teachers and administrators who are trying to do this new thing under a pandemic has been very, very difficult. And so for many communities of color, what we've asked is, our nonprofits are foundational in our community. They are leading, their relationship, we're connected. Why not create a process where we are engaging nonprofit members, organizations with our educational system? Because we know teachers cannot do this work alone. They need additional help. And so we're still waiting for Department of Education to, I do believe that money was set aside to do some of this work, but it's taken like way too long for that process to be created, to get the RFPs out into communities so that we can create, have this nonprofit who are from diverse communities, who looks like the community, who are from the disability community, who are from the mental health community, to be a part of this learning process as people of all ages and stages and backgrounds are dealing with a huge amount of stress.
Thank you. We've touched on it a little bit in some of our other responses, but our next question is about the challenges in regards to access to technology with the shift to telehealth and telemedicine. With COVID-19, many providers have converted to virtual visits to provide care, but telehealth and telemedicine have posed major obstacles to API Minnesotans, ranging from issues including a lack of access to technology, which we've mentioned, to also insufficient language support. What action should the state take in order to make sure that healthcare is both accessible and able to be accessed? So it's not just that the providers are able to shift to offering these virtual visits, but making sure that people that need these services are able to access them when they need it.
I went first last time, but I'll be happy to go again if no one else wants to.
We were vetting about that. I go real quick.
Okay.
Okay, thank you.
So, right, access is the place. Quite frankly, telemedicine and telehealth does has its role to play. And it's not just a rural thing, it is really a statewide support of getting access to a healthcare professional when you're not able to leave your home. You have that access. But again, we're looking at access to internet, to be able to afford the internet, to have a hotspot. And so all of those things that we saw in the education system, we can also see that could be a problem for many in the urban core, which I didn't realize in the urban core, we don't have some of the best connections locally either. And so, I opened up by talking about reimagining. And I mean, we are really in this process of trying to reimagine how we have access to healthcare. How do we have access to medicine? How do we have access to information without the fear that your information is going to be shared too widely with other people, or people who have access to your medical records? Those are things that real people think about every single day, and how your records and how that's been used or utilized. But I do believe that telemedicine, telehealth has a really good role to play. I know our commissioner of PHS and is really trying to find out how we can extend, even after the peacetime emergency, how we can extend the use of telemedicine, telehealth, because we've found out that it has a pretty good role to play in access to healthcare. And so I just stopped there. I know Representative Leafland been working a lot on this telehealth, telemedicine. But yes.
Yeah, so it's a great question. I think this is an area where the pandemic and the sudden shift to telehealth is also going to drive some improvement, one hopes, in the availability of technology across the state, because that is an area, definitely the disparities there are tremendous. And so that's going to be something going forward. But you kind of touched on the interpreter issue, and I know both Representative Miranda and I have both worked on the initiative that the council has on interpreters and trying to improve the quality of interpretation and give people, obviously Medicaid pays for interpreters for people who have our public insurance. And I view that as absolutely necessary to have high quality interpretation, because if you don't understand your provider and the provider doesn't understand you, forget it. It doesn't matter whether you're in the room or doing it on video. So that is absolutely critical. And the other thing I just wanted to point out is, as good of an experience as many people are having with telehealth, we have heard some really good responses to that. I'm not just thinking of it as, okay, we're all in and we're just gonna, I think this is a time when we are gathering data to be able to look closely at it, so that when this period of time ends, we can examine whether and what parts we want to go forward with. Personally, I have worked on in our public programs and for regular other private insurance, what the networks are that the insurance companies are maintaining. And personally, I am not at all ready to say, oh, you've got telehealth, well, then you don't have to have a physician available in that part of the state. I think that would be a huge mistake. We have to have, telemedicine does not replace all human contact. I'm not a medical provider myself, but I don't know how you make diagnoses without, I mean, Senator Abler is, as a chiropractor, I'm sure, how do you evaluate a patient that you can't really see in person? How do you, I mean, there are just so many pieces that are missing in that equation. So I think it will have a role. I think the role will continue to be bigger than it has been in the past. But it's something we're going to have to evaluate very, very carefully, and certainly with an eye toward equity. And our people who already suffer from health disparities able to do better with more different ways to access providers, or is it just creating a worse problem? So definitely on the table.
And I'll just offer a very short thought, and the two commenters did a great job of covering the topic. Just looking forward, we do want to make sure it actually, how did it work? How were the mental health outcomes of people that did telehealth compared to going in person? How were the chemical dependency treatments? Were they just as good? Did it work? And how were the diagnoses? Were they just as correct? And Representative Liebling, as we go forward into the money discussions next year, and I understand you have no opponents. You're the only one sure to come back, I think. So I think we pay the same for telehealth. And if the costs are lower, and we may need to put some pressure on the system to not reward people, a system that doesn't have as many costs, as we can try to maintain, all the coverages and all the equity issues and all that. So there you go. Thank
you. I believe we have time for perhaps one more question before we begin the closing section of the program. This question is, can you speak to making grants administered by the state more equitable? Are there plans to include more community members in the grant review process? For example, can the state make it a requirement to have X number of community members on grant application review panels for any state funding opportunities?
Well, I would say that definitely, again, these are all issues when it comes to, equity, whether it's in healthcare, jobs, or education, healthcare, environment. We're trying to make sure that we bring that equity lens to the legislative body. And we don't think it should be something additional that we're doing. It's just how we do our work, because historically we have not been able to do grant processes that was equitable. It just didn't hit our community. Often we talk about urban, rural, right? But when urban, rural, there's still these communities of color that we feel have been left out the process of doing it in a way that is reaching those communities. I was just looking at email from one of my colleagues, Jake Zone, as we are talking about COVID-19, money available for small businesses and money grants that is going to be used for businesses, small businesses who have been impacted by COVID-19. And it's the grant process is available and it's out there. But is it in Hmong? Is it in Somali? Is the grant process in those different languages? If they're going to have a special session on the grant process, is those sessions going to be done in many different languages? Something that we often just don't think about. It's like, if you don't speak English, well, too bad. And so we really got to do better at, engaging diverse communities in the selection process, who brings up just, an additional lens to the table that sometimes others do not have that same type of lens. And to hear keywords and to hear things that sometimes others don't hear, because we have put ourselves in a box of what we're listening for and what we want, or what is needed. And often what is wanted and what is needed, what we hear, is weeding other people out of the process. So I'm a one who believes that diversity of minds and bodies and action is a strength. It's something that we all can utilize in much of anything and everything that we do. It just makes things better in my mind. And so I can't say whether DEED is doing it in a high number, or whether it's coming from the commissioner and then looking at the grant process for dollars that needs to go out and working in partnership with communities, who is doing that selection process. But we did suggest that it would be more diverse people helping to view those applications.
And I mentioned this before in just one of my random comments. It's ironic. I believe the Department of Health actually has a relatively diverse group of people looking at some of this. And some of these programs are designed for health disparities, for diverse populations. Saying that, I don't think that they've done as well as they could do with the monies they've had to have the goals that they've tried to accomplish. And I think it would be well worth this group as well as other groups to look into it, and how is it going? How do they judge? And if you have one person from a particular community, is that person doesn't know everything about everything else in the community, and so what are the outcomes? We spend a ton of money. There's a couple $100 million a year at least in grants that go out for purposes that are designed for some benefit that we put together. And they're very thoughtful purposes. Are we accomplishing those purposes to the extent we want? So I think if there's a takeaway, in my opinion, that this would be a great area to put some time. Just because you pass a bill and you put down equity and health disparities and list a set of communities doesn't mean it's going to touch anything in practicality. And so legislators are so high, we passed the bill to fix something and we feel good going home. But then the implementation is everything. And so I think between, and so there's talk about passing more things, which should be fine, or changing things up a bit. But how things get implemented is everything. So that's my advice to you as a group.
So I would just add quickly to what my colleagues here said that, first of all, I think it's absolutely, we should have diverse groups of people looking at these. And so, that is, thank you for raising that issue to the questioner. I would just add to what Senator Abler just said, that I think when we pass something new or when we put out a new grant for some purpose, we should also build evaluation into that. Because this goes back to what we were talking about before with results first and the evidence-based. Not everything is susceptible of real evidence and can be proven to work, quote unquote. But many things can be better evaluated than they are. And especially in a time of shrinking resources, but any time, we need to make sure that we at least try to get evidence about how things are working, what the outcomes are, so that we can emphasize the things that do work and not keep paying for things that don't work. And it doesn't always necessarily line up, frankly, with how popular things are. I mean, we know that people often believe strongly in something, even though the evidence may not be there. And so this is not something that can be decided by machines. It's human beings have to weigh all these different factors. But I do think that really thinking intentionally on the front end, not only about who's going to decide who gets the grant, but also structuring our grant process so that we get some real information back about how successful a strategy was, is something we should pay more attention to.
Thank you very much. This has been a great conversation, but we are approaching the end of our time. So at this point, I would like to invite the Council's Executive Director, Sia Her, to provide us with some closing comments. Sia.
Give me a second here.
Okay, whenever you're ready.
My staff restricted my access into this conversation to ensure that I don't jump in, representatives and senators. So here I am. Thank you so much for your time with us today. It's really good just to see all three of your faces, because it has been quite a while since we've seen one another. And this year, because the board asked that I be more community facing and allow the staff to take almost full control of the legislative work of our council, I especially haven't had any opportunities to interact with the three of you. So I give you that rather nuanced explanation as my way of saying I have missed all three of you. So having said that, I want to share that I promised my staff that I would be brief in my closing remarks, but I will have to backtrack on that just a tiny bit, Andy. I recognize that we are at 3 minutes until ending time, but I'm going to push us beyond that, if it's all right with everyone on the call. I thought there would be a chance of this happening, since I know all three legislators relatively well. I would say better than most other legislators. And this is because I consider all three of you as friends, not just colleagues or legislators with whom our council works with. So I will be careful in my comments, but I won't be as brief. And my remarks will be somewhat general, because the three of you and Andy have covered so many issues during this panel. I've been executive director for seven years now. I'm well into my 7th year. And so I'm especially thankful for the three of you, because you're members of a small group of legislators who I trust and feel that I can come to, not just to be heard, but to be understood. I think it's almost impossible for us to talk about, taking a community's reality into consideration and having that reality be reflected in our policies if we don't understand the reality of that community. And so as executive director, I've really appreciated the relationships we have had with all three of you, because it's in that safe and secure space between us that I really feel you have been some of the best champions of the community. So thank you for your leadership on issues of importance to our council, because these issues we believe are issues of importance to the broader API community in the state of Minnesota. All three of you know, and I have said this in time and time again in committee hearings, as well as in letters submitted to the legislature and members members of the executive branch of government, that as members of smaller communities, as members of communities of color, members of immigrant and refugee-based communities, Asian Pacific Minnesotans are particularly vulnerable to being invisible in the policymaking process, especially that which occurs at the state level. And this isn't to say that the three of you haven't been some of the greatest champions of our community. I'm simply saying that we recognize at the council that the size of our community, our mannerisms, and a few other factors, including the politics of our time, combine to make us as a community less visible than other groups of Minnesotans. And yet we strive to be more visible via multiple forms of interactions, which all three of you touched on to great lengths today. Um, in politics and in policy, we continue to strive to be more visible. Sometimes our votes are considered, sometimes they are sought out, sometimes our policy needs are met, at least to some degree, because of the varied ways in which we have attempted to insert and assert ourselves. And you touched on the fact that during COVID-19, interactions have been curtailed significantly. So I agree that while email and Zoom are not terrible communication or interaction tools, we at the council know that our community members' inability to engage in person makes it even more difficult for most of us to be heard, understood, and taken into consideration, especially at a time when the challenges that we were facing prior to COVID-19 have been magnified to who knows how many times, right? So at the council, and particularly in my capacity as executive director, I've led in such a way so that we, the council, strive to be the bridge between you and Asian Pacific Minnesotans. And even then, we at the council, as a team of 5 FTEs, we have been stretched thin in capacity because we have had to triage what we must immediately do in order to increase the chances that Asian Pacific Minnesotans have some of their most immediate needs addressed. So, I add to this conversation about the limited interactions, a particular piece that I haven't heard brought up in all three panels that we've hosted, and you're members of the third panel, and that's this piece that I've noticed. So I've watched our politics intensely, and that's really an essential part of my role and responsibilities as executive director. And I've noticed that as the intensity of our politics have increased, our community's collective ability to be a part of the process tends to have decreased. And this was especially clear to me during this special session, especially toward the end of it. The question that kept me awake at night and loomed large before me day in and day out was this question of how do we at the council help to bridge the gap between government and the people, particularly in a time when our leaders are so entrenched in their respective partisan camps and their perceptions about which camp Asian Pacific Minnesotans belong to and how many votes we have to offer up, have very specific and large roles to play in this equation that leads to whether or not we have space and time at the table and where our stories are heard, understood, and taken into consideration. And so I leave you with that question. It's more of a question than a statement, and any kind of insights that the three of you have, I'd be more than happy and deeply appreciative of the opportunity to take that conversation offline. So I'll end on the note that we're deeply appreciative of the time you've taken to be with us this afternoon. Our team will continue to contribute to the legislative and executive branches' collective capacity to not only design, but to implement policies that serve all Minnesotans. And toward the tail end of this conversation, you spent some time talking about policies and procedures that would ensure that during implementation, the legislative intent remains intact and that we get to the very Minnesotans that we that inspired the legislative proposals that we put through the process. So, I spoke rather fast, but to the community members on the call this afternoon and to all three of you, Representative Moran, Representative Liebling, and Senator Abler, thank you for your ongoing commitment to engagement, because we don't have any choice but to work together to ensure that we all have access to the opportunities that will allow for all of us to eventually, if not already, live lives of dignity and prosperity. And so in my capacity as executive director, thank you so much to all of you. I hope that you will continue to call on us, legislators, and I hope that I will repeat what Senator Abler said in his informational hearing earlier this morning, and that's that I hope that we will all be able to overcome these very, very trying days. So thank you.
Thank you.
Thank you.
All right.
Andy, back to you.
Thank you. I know we're over time, but I'd also still like to offer the chairs the chance to offer any closing thoughts. Senator Abler, would you like to?
Yeah, just really brief. I think you should tell us 30 seconds and then that'll help. I'm not kidding. Anyway, so I think everybody watching this, it's our government. It belongs to us. I think it's just interesting how groups feel not heard or listened to or understood. I think every group wishes they could be better heard and better understood and have more input, which means that it's not so unique. So, but the way to have that is to show up, get to know your representative and senator. Everybody has at least one. They may have one from their job as well. Please weigh in. We're not smarter because we're elected. We just are in a position to have to make a decision. So help us make those decisions well. And I am so grateful for all your comments and input tonight. Pray God's blessing on all of you all and us in these really hard times. Thanks for having me.
So
Thank
I
you.
go.
Chair Moran, please.
So I just want to say thank you to the council. See her, I cannot believe it's been 7 years. But I am thankful for the council because so often with our communities and community of color, it's the cultural piece of the belief in government. It is the distrust of government. It is the disconnect that we often feel from government, that we often don't find ourselves showing up at the Capitol. But that is the role of the council. The role of the council is to be that interconnected between the community and the government, right? To help and engage and inform the community, but also to help and engage and inform the legislature about the Asian American community. It is a needed entity, and I just thank you guys for your advocacy, for your support, and for your ability to always strive to keep the Asian Pacific Islanders communities connected to a much needed process that needs their voices, that needs to know who you are and who you are. So, and thank you for this moment too. Appreciate it.
Chair Liebling.
Yeah, so thank you. First of all, I really appreciate the opportunity. I always learn more from these kinds of conversations, I'm sure, than anybody gets from me. So the questions were great, and hearing my colleagues is really, really helpful too. Sia, I look forward to talking with you offline because what you said really kind of puzzles me. Sometimes I think, never think something is malice when it's just, when ignorance would explain it. That's kind of comes to mind. Maybe that's wrong, but anyway, I hope we can have more dialogue about your concerns about that. But I also really appreciate the work of the council, and I agree the Asian Pacific community does tend to be more invisible. It doesn't, and maybe part of that is that it consists of so many different cultures and so many different languages and needs, and but. I'm very, very grateful that the council exists, and I just would say, don't give up. Make us listen. Please make us listen. We need to hear what you have to say. So thank you very much, everybody.
Thank you once again. That adjourns our meeting.
All right. Bye-bye.
Have a good day.
You too.